Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. Have you ever felt like the very thing that drives you to care for others is slowly squeezing the life out of you? Well, if you're a healthcare professional, you're probably nodding your head right now. Burnout is a real crisis affecting everyone on the front line of healthcare. In this episode, we'll be diving into this dire issue of burnout in healthcare professionals with occupational therapist Maphefo Masegare.
My name is Maphefo. I'm an occupational therapist by profession. I'm working in the mental health psychiatry field of OT because occupational therapy is so broad. And I'm servicing the areas of Benoni and all the surrounds, working in hospitals, seeing patients in hospitals, and also on an outpatient basis. So if anyone reaches out and needs services, I'm also available. I'm very passionate about mental health, as I do believe that a lot of people are not in tune about their mental health or have tools and ways to manage their mental health. And furthermore, people that do have mental illnesses are often stigmatized. So I really do see myself as an advocate for those mental health.
Thank you so much for that beautiful intro, Maphefo. So let's go straight into our conversation about burnout in healthcare. How would you define burnout and what are the main causes or contributing factors to burnout in the healthcare industry?
Burnout is a hot topic at the moment. Post-COVID, a lot of people have been hearing about the word burnout. But for me, I think just defining it is in using the three pillars of burnout. And the first aspect of burnout is that burnout has to do mostly with your work. Feeling a lack of motivation towards your work, feeling a sense of like you have an oppositional, more of like an antagonistical view towards your work. You don't feel as motivated about your work as you used to before. And perhaps you can also be resenting your work. By work, I mean anything that is productive and anything that you wake up to in the morning and brings in a sense of income, but, gives you a sense of productivity. The second aspect of burnout, in terms of defining it, will definitely be that feeling of exhaustion. I almost want to use the word lethargic because exhaustion is a little bit of a mild term. When I speak about lethargic, it's more of like that chronic tiredness that you just can't get out of, no matter how many hours you sleep at night or you try and rest, but you still feel tired. So you just feel so lethargic, and that can be body, mind, and soul. In all of those aspects, you just feel that chronic tiredness. And then the last aspect is just more, you get like a mental fog where you feel detached from yourself. Like mentally, you are not in a clear space. You are not able to concentrate, you're not able to focus, you mentally feel wound down. You don't just have the list to do anything from a mental point of view. And I think it's very important for me to mention that from how I've defined it, it can very much share similar symptoms to other mental illnesses, but it's very important to note that with burnout, it's usually related to work, specifically that aspect of work. Whereas things such as depression and anxiety are a bit more complex and compounded.
Maphefo, so what would you say are the common signs and symptoms of burnout in healthcare professionals?
I'm going to refer to a tool that I like to use with some of my clients. It's called the Maslach Burnout Inventory, and it's a self-test that actually gives you an idea of what symptoms to look out for as a health professional and also as, the general public. And one of the first signs is you feel emotionally drained by your work. You feel that working with people takes a great deal of effort. You feel your work is breaking you down. You feel frustrated by your work and you feel at the end of your rope. And then other aspects as well, you feel tired when you get up in the morning, don't have the motivation to face another day at work. You don't really care about your clients or your patients. And I think for us as healthcare professionals, on the day that you graduated or were officiated as a healthcare professional, we have what we call the Hippocratic Oath that we need to undertake. And in that Hippocratic oath, that's basically where you swear your life to your patients to say, I will take care of my patients. I will look after my patients. I will be responsible for my patients' health. And as healthcare professionals, I think we are victim to taking that so literal to the point where you overextend yourself and you start doing what I call you overextend your compassion. You know, as a healthcare professional, you have to be compassionate and empathetic to your patients. But when it starts overextending to the point where it just becomes too much and it lands up into burnout. And I've got a perfect example of this as well. You often hear some clients or patients in the public space speaking about how they get very bad treatment from government healthcare facilities. You know, they'll say the nurse is rude or the doctor was not taking care of me appropriately. Mm-hmm. And this is just my personal observation. I think a lot of that has to do with this aspect of burnout, the overextending of compassion. And those are the signs that we see that, you know, someone is burnt out and they just don't have the energy as well. You know, someone who used to be very goal-driven at work, I want to accomplish A, B, and C, just becomes another day at the office. As long as I do 50%, that's it. Those are sort of the signs that we look for as a health professional, that you are either burnt out or on the verge of burnout.
What would you say are some of the most promising solutions for reducing burnout rates in healthcare in the long term? And what resources are available to healthcare professionals who are struggling with burnout?
I don't know if it's a promising solution, but I can speak from a personal experience. When I was still starting out as a therapist, I definitely did experience burnout. And at first, I didn't understand what it was. I had no idea, what is this? I just don't feel motivated to do my work. And I only learned about burnout after I had burnout. So I think the most important thing as a healthcare professional is that you need to understand what burnout is. We are very good at preaching it to our patients, but it's very important at this moment to not just practice what we preach, but to preach what we practice. And we need to practice understanding what burnout is and understanding what it looks like in ourselves, especially in this profession of caring for others. That for me personally was the first step, is understanding that you are burnt out and these are the symptoms and signs that you are showing that you are burnt out. And for me was then, you know, to sort of have an action plan from there and say, well, how did I get into this mess? And for me was obviously working long hours, not taking breaks, not having boundaries with some of my patients. You know, I started personally investing in patients. I became a therapist and a friend, and I think it's very important for us to have boundaries with our patients and with the people around us so that we protect ourselves, protect our inner space, so that we don't overextend ourselves. In terms of what resources are available to healthcare professionals, I think the biggest resource is reaching out. I know that sounds very cliche and I know that sounds overdone and oversaid, but it really is, and was for me, again, I'll go back to my personal experience, was the changing point, is just reaching out to other healthcare professionals and understand that, you know what, actually, I'm not the only person who has gone through or is going through something like this. And it's something that's inherent in our profession. So it's very important to be aware of it. There are a lot of platforms that healthcare professionals may be aware or not aware of. For example, with me, I'm part of OTASA, which is the Occupational Therapy Association of South Africa. And that is just a group of healthcare professionals, OTs in South Africa that have come together. And so I use that as a platform. And they have forums, you know, that educate us on how to take care of ourselves as healthcare professionals. And those are sort of resources that we can reach out. I'm sure with other professions as well, like your doctors, physiotherapists, psychologists, there are also similar platforms that people need to reach out on and, you know, just speak up, and we can share ideas and tips and tricks on how to take care of ourselves. If it does get to a point where it starts seeming to be a mental illness, it is very important to obviously get psychiatric evaluation as soon as possible, because burnout can unfortunately lead to your depression, your anxieties, and your more complex psychiatric or mental illnesses. So if it gets to that point, definitely reach out to the appropriate professionals. But burnout is very much preventable. So within your professional space, definitely reach out to other professionals and seek help.
So in closing, do you have any final words of advice for healthcare professionals who are feeling overwhelmed or on the verge of burnout?
It's very difficult. I think when you're in that moment, I'm just thinking back to when I was burnt out myself. You feel so stuck, like I'm never going to get out of this space. But the biggest advice I would give is take time out. Literally, if you have to remove yourself from your workspace, do that. Whether it's for a week or 2 weeks, do that. And your rest and your time off needs to be productive. I always say this to other healthcare professionals and my clients that our rest needs to be productive. When I say productive rest, I'm saying you can't be saying I'm off work, but your work phone is still on and you're still getting calls from your colleagues and you're still getting SMSs from your patients and you are still investing in some aspect of work. That is not productive rest. If you have to turn off that phone, turn it off and just be productive in your rest, in your time off, and use that time to reflect, to meditate, to pray, to practice mindfulness, being in the moment, grounding yourself and just reconnecting to yourself is going to be very important. And also going back to doing stuff that you liked, things that gave you a sense of meaning in life. You know, if you used to jog like myself, I'm someone who jogs, go back to doing that. If you're someone who loved ice skating, go back to doing that as part of your off time. It does a lot of wonders in just bringing back a sense of meaning and belonging to yourself, most importantly. In that moment of reflection as well, go back with a different strategy when you go back to work after that time off. Don't do things the same way that you did because it just defeats the whole purpose. Take time off and make sure it's a productive time off, productive rest.
Thank you for joining this week's episode of the Health from Mzansi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Mzansi podcast, and your ears are always invited. So let's end this episode with a spark of hope, not exhaustion. Burnout is a serious issue, but it's not an inventable one. By acknowledging the signs, implementing self-care strategies, and fostering a culture of support within healthcare systems, we can create a future where caregivers thrive alongside their patients. Stay healthy and fancy. I am your host, Candice Khumalo. Until next time.